Hi, good evening, classmates. For tonight, this will be the last part of the waterborne diseases report. My topic will be about the clinical and public health actions and aftermath of the outbreak, preventive measures, and the learning lessons. The immediate clinical response in Kananga after Typhoon Haiyan was critical as health facilities were quickly overwhelmed by a surge in gastroenteritis cases. Healthcare workers focused on rapidly identifying those affected, both at clinics and within the community. Assessing the severity of symptoms, particularly dehydration, was crucial for prioritizing care. Rehydration was the cornerstone of treatment, using oral rehydration therapy for most and intravenous fluids for severe cases. Although while awaiting lab results, antibiotics might have been considered for the sickest of the patients based on local guidelines. Importantly, collecting samples like rectal swabs was essential to determining the cause of the outbreak. Public health teams quickly mobilized to investigate and contain the outbreak. Epidemiologists conducted interviews to understand how people got sick, focusing on potential exposures like food and water. Environmental teams immediately assessed the water system for typhoon damage. Collecting water samples from various points was vital to identify contamination. Early public messaging emphasized basic hygiene and the need to boil water. Effective coordination with local leaders and disaster response agencies was crucial for a unified approach. Analyzing the data from patient interviews helped identify common exposures, particularly related to water consumption. Laboratory results confirmed Aeromonas hydrophilia in both patient samples and the contaminated water supply. Investigators linked the outbreak timeline to damage in the water system, particularly the pipes, which were caused by the typhoon. They also found out that the disinfection of the water, measured by the residual chlorine, was insufficient. So, mapping the locations of cases helped visualize the potential spread throughout the network. The outbreak resulted in 105 identified cases, and analyzing the demographics helped understand who was most affected. Assessing the severity of the illness, including how many required hospitalization, highlighted the strain on local health resources already impacted by the typhoon. Beyond the immediate health crisis, there were likely economic consequences for affected individuals in the community. The added burden of illness on top of the disaster also likely had a psychological impact on the residents. Long term prevention requires building resilience. This involves investing in upgrading water infrastructure to better withstand disasters and implementing comprehensive water safety plans. Strengthening local health capacity for disease surveillance and response is vital. Integrating water, sanitation, and hygiene into disaster preparedness ensures these needs are addressed proactively. Educating the community on sustainable safe water practices and establishing early warning systems for potential contamination are also key. This outbreak underscored the critical link between damaged infrastructure and waterborne diseases after disasters. It highlighted the need for swift and coordinated investigations and proactive public health communication. The vulnerability of communities with compromised water systems requires targeted interventions. Strong collaboration between agencies is essential during emergencies. Ultimately, this event emphasizes the importance of investing in resilient infrastructure and robust WASH programs in disaster prone areas, adding valuable lessons to our understanding of post disaster public health response. This finishes our report for tonight. Thank you very much.